Hey everyone, welcome to this explainer. I am so thrilled you're tuning in today. We're going to be unpacking something that literally every single one of us can relate to. Because, let's face it, dealing with physical pain? Yeah, it's just a part of being human. Whether you're an elite athlete pushing your absolute limits, someone navigating the daily grind of a desk job, or honestly, just someone who bent down to tie a shoe and suddenly felt that sharp, horrible twinge in your back, we've all been there. And when that pain hits, we're usually bombarded with so many different ways to fix it, which, can actually be super overwhelming. So today, we're diving into the source material to decode two of the most popular, but seriously, most frequently confused, paths to getting your body back on track. Physio or massage. Sounds simple, right? But man, this creates a massive paralysis of choice for so many of us. Picture this. You wake up, roll out of bed, and boom. Your neck is impossibly stiff, or your shoulder is just screaming at you. You know you need professional help, but who do you actually call? Do you need a strict clinical diagnosis to pinpoint exactly what mechanical failure is happening in your joint? Or do you just really need a fantastic deep tissue session to work out those knots? It is such a common dilemma, and picking the wrong one can honestly just delay your recovery. So in this explainer, we're going to clear up that confusion once and for all. Section 1. The Architect. Physiotherapy. Okay, let's dive into this. Think of physiotherapy kind of like your body's architectural diagnostician. If your body is a complex building, the physio is the structural engineer you bring in when, say, the foundation starts to crack or a load-bearing wall starts leaning. Our definition here states it's a healthcare profession aiming to assess, diagnose, treat, and prevent a wide range of physical conditions, impairments, and disabilities. The absolutely crucial part is right there in those first two words, assess and diagnose. You don't just point to where it hurts and they start working. No, they conduct a rigorous evaluation to find out exactly why that foundation is cracking. They establish a concrete clinical diagnosis before treatment is even on the table. And once that diagnosis is locked in, the physiotherapist basically puts on their mechanic's hat. They're utilizing very specific techniques, exercise, manual therapy, and a heavy dose of education and advice. The goals here are highly active. They aren't just doing things to you, they're actively working to restore your body's movement and function. Relieving your pain is huge, obviously, but preventing further injury is just as critical. They're literally giving you the blueprint and the exercises you need to make sure that once the structure is fixed, it actually stays fixed. And really, this just highlights the sheer scope of physiotherapy. We so often associate it with just like a pulled hamstring from a weekend soccer game, but it is way broader than that. Physiotherapists work with people across their entire lifespan, from fragile newborns all the way up to older folks needing mobility assistance. They tackle musculoskeletal injuries and chronic pain, sure, but they also treat complex neurological conditions and even respiratory issues. It's a hugely versatile, comprehensive medical discipline that's all about keeping the human machine operational. Section 2. The Optimizer. Massage Therapy. All right, let's take a deep breath, soften our focus for a second, and shift gears. If physio is the architect, massage therapy is the ultimate optimizer. It is the manual manipulation of the soft tissues of the body, specifically muscles, tendons, and ligaments, to enhance a person's health and well-being. Notice the total shift in language here. We're not throwing around words like diagnose or impairments anymore. The focus is entirely on soft tissues and providing a really broad, holistic, soothing, hands-on approach to promote overall harmony in your body. To get to that state of well-being, massage therapists rely on a specific set of manual techniques. We're talking kneading, rubbing, tapping, and vibration. And these aren't just, random hand movements. They are highly refined, tactile methods used to manually work the body. Just imagine all the physical stress, the tight knots, that rigid tension you just accumulate throughout a crazy week. These techniques are purposefully designed to physically break down and just melt away that built-up tension trapped in your soft tissue. By applying those exact manual techniques, massage therapy's main gig is to relax muscles and release tension. But it goes way deeper than that. It actively increases blood flow and improves your overall circulation. And that flush of circulation is so vital because it promotes cellular healing while also helping to alleviate general stress and pain. It's really all about creating the absolute ideal internal environment for your body to rest, reset, and rejuvenate itself. Section 3. The Showdown. Comparing approaches. Now, what's really interesting here is how sharp this contrast actually becomes. We've looked at both of these in isolation, but the real aha moment happens when we put them head to head. If you're still paralyzed by the choice of who to call, this is going to be your cheat sheet. Physiotherapy? It is fundamentally focused on the diagnosis and treatment of specific conditions. It's targeted, it's clinical. Massage therapy, on the other hand, is primarily about relaxation and general, holistic well-being. While both of these therapies absolutely want to alleviate your pain and improve how you function, their ultimate end goals are totally distinct. One diagnoses a specific structural failure, the other optimizes your general state of physical relaxation. Section 4. The synergy, combining forces. Let's move on and see how this actually builds into something way greater. Up until now, we've kind of been talking about physio and massage like they're totally separate lanes on a highway, right? Or rivals in some competition. But the beautiful truth, and the biggest takeaway from our source material, is that this is not an either-or situation. Not at all. It's a synergy. Quote, "The right blend between physiotherapy and massage therapy is optimal for most injuries or pain conditions." Just think about the weight of that statement. For most injuries, acting as a tag team is literally the most effective way to reach your mobility goals. You get that clinical diagnosis and structural rebuilding from the physio, seamlessly paired with the deep tissue tension release and optimized circulation from the massage therapist. They're just two halves of the ultimate recovery coin. So how do you actually apply this synergy in real life? Well, the source lays out a super straightforward checklist. Step 1, consult a professional near you. Step 2, call them up and discuss your problem over the phone so they know exactly what you're dealing with. And step 3, work with them to find that perfect, ideal therapy blend for your specific condition. And hey, if you happen to be in the Greater Toronto area, the source explicitly mentions they have walk-in-ready clinic locations in both Etobicoke and Mississauga that are completely equipped to help you hit those mobility goals and kick that pain to the curb. Which brings us to our final thought for this explainer. Is your body asking for a diagnosis or just a little relief? Or, maybe it's asking for both. Armed with this clear understanding of what physiotherapy and massage therapy actually do, you don't have to guess anymore. Listen to your body, empower yourself, and go take that next step toward feeling better.